Hello, everyone. Happy New Year. For those of you who don't know me, I'm Deborah Albanese. I'm the Executive Vice President of the Englewood Health Foundation. We're here today with Dr. Stephen Bronquell, who is the President of the Englewood Health Physician Network and the architect of Englewood Health's rollout of the COVID-19 vaccine. We're going to spend about a half hour together today with questions, as you've done in the past. Those who have participated in these seminars in the past, just use the Ask the Question feature, and certainly we'll get to as many as we can, during the program. So welcome, Dr. Bronquell. Thank you.
Thanks, Deb.
Wake up every morning, open the New York Times, and we see a lot of gray and black on the United States map related to COVID. We were the epicenter last year. Where are we now? Where's Englewood Health now?
Deb, I don't want to say this too loudly.
Okay, well, there's a lot of people on the phone here.
100 people online right now. We're not actually in a bad place. And I have to congratulate our entire community that so far we've not seen a rise in cases since the holiday period. After Thanksgiving, just to put it in perspective, last spring at our peak, we had almost 230 COVID patients in the hospital. We had essentially nobody else except a few heart attacks and some mothers delivering children who wouldn't wait for the pandemic to be delivered. But essentially the whole hospital shut down, as we know. So then we went down in July, August, September. We had between 1 and 4 cases. It was summertime, people were outside, things were pretty good. Then as the cooler weather started, the number of cases started to go up. And we went to 20 and then to 30. And then we hit a peak of 11 days after Thanksgiving at 66 cases, with about 9 in the ICU. We've come steadily down since then, and we're in the low 30s at the moment. For Englewood as a hospital, we can manage this. So a lot of us talk about having 2 hospitals right now. We have a COVID hospital and we have a regular hospital. We can run the COVID hospital and take care of those folks, and the vast majority are getting better and going home pretty quickly. And we can do our regular medical work, because as we found out last spring, there were an awful lot of people who avoided the hospital for obvious reasons, who didn't come for care that turned out to be more urgent than they thought at the time. People postponed cancer screenings, and we've seen some of the fallout from that. And we did not want to do that again.
Right.
So thanks be to God, we've not had to do that, and we've been able to do our mammograms and our stress tests and our cancer screenings, and we've taken care of what we've taken care of for 130 years, and the COVID folks. So as long as things stay as they are, we're okay for today. Ask me tomorrow.
Okay, I'll ask you tomorrow. Ray of hope, we have vaccine. We have federal government approved 2, Pfizer and Moderna. Can you talk a little bit about the differences between those vaccines and their efficacy? We get a flu shot every year. We're going to have to get these vaccines every year. What are we doing?
So the 2 vaccines that are approved, Pfizer and Moderna, actually use the same technology. It's called mRNA. So they have very similar safety profiles and very similar efficacies. Frankly, astounding efficacy rates. Most were hoping for a 50-60% effective rate for a vaccine. They got in the mid-90s, which is just amazing. Which means that if you get the vaccine, there's a 95% chance that exposed to COVID, you will not get sick. So no vaccines are perfect, but 95% is pretty darn good. So this is a relatively new technology. It is perfectly safe. It does not alter your DNA. I've heard that any number of times. Apparently, it's one of those things that's bouncing around social media. There's no validity to that at all. It sends a message into a cell, which triggers a response, which in turn triggers the immune system to make antibodies. It leaves your system within a day or so. It does not alter your underlying DNA, which is our genetic blueprint to determine who we are. So it's a novel technology. It's extremely effective. So there's very little differences to the patient between Pfizer and Moderna. There's a difference to us because the Pfizer vaccine is actually somewhat challenging to handle. It has to be kept at super cold temperatures. It can only be out of those temperatures for a short period of time. The Moderna vaccine's a little bit easier to transport, just a little bit easier to handle. But in terms of efficacy and safety, almost exactly the same.
Am I going to have to get one next year?
We don't know yet,
Okay.
right? So even the study patients on which these got their emergency use approvals, those people are really only a few months out. I mean, we're going to need to measure antibodies, 6 months from now, 8 months from now, a year from now, and if the antibodies levels go down, we may need a booster. But I think it's way too soon to even be concerned about that. My concern right now is to convince people that this is a safe vaccine. And I'll share our own data here. We've done 3,100 people. Actually, tomorrow morning starts the second dose for some of our team members. Of the 3,100 people, we had 5 mild reactions. And when I say mild reactions, this was a little bit of itching, maybe felt a little dizzy, had to sit down for a few minutes. A couple of people got a Benadryl. Nobody got sick. Nobody was admitted. There was no anaphylaxis. There was no serious reactions at all.
Okay.
I read a piece last week written by a pediatrician, which bears repeating. He said, we have anaphylactic reactions all the time to penicillin in this country. And written as a pediatrician, we give penicillin to kids for strep throat, right? That's the standard. It still works. And there's a handful of anaphylactic reactions every year. Those kids are treated. It's never prevented us from prescribing penicillin. Right. And so I would put it in those terms. So far, over 3,000, a handful of mild reactions. The data shows that the second dose might produce a few more reactions. Most of those are fatigue and muscle aches.
Okay.
And that is because once you've primed the pump, so to speak, on the immune system, it may, and you give a second dose, you may sort of over-rev it a little bit. Again, these are mild reactions. It's a little Tylenol, it's some fluids, might be out of action for a day.
So while we're on the vaccine, one takes the vaccine, finishes the course, two doses. You said that you're 95% that you won't have symptoms. Does that mean you don't get the vaccine? That you don't get the COVID?
That you would not become sick. Correct.
You would not become sick.
You would not become sick. Even if you're exposed to the virus, you would not become sick.
Okay.
Yeah.
All right.
Which is substantially better than a flu shot. I mean, we all know that flu shots are not great. They're better than nothing, and we should get them. But they usually run in the 40-50% rate. Okay.
Well, that's good news. So the CDC has very specific guidelines for who can get this vaccine on what schedule. Can you give us an overview of that? Because we're all interested in that.
Yeah, we all are. So we're in the 1A phase, and this is so the CDC has established the categories. It's up to the states to determine when to implement those categories. So right now in New Jersey, we are still in 1A, and that includes frontline healthcare workers, nursing home patients, and the like.
Okay.
We're preparing right now for 1B. 1B are folks 75 and older and certain essential workers. The state of New Jersey is still defining what those certain essential workers are. But that's the next group to go. 1C are people between 65 and 74, and those between 18 and 64 who have medical conditions. And then group 2 is everybody else.
Everybody else. So we're looking at 1A and 1B now, and you say we're preparing for 1B. Englewood Health is making a very significant commitment to its patients and to its community related to vaccination. And as I said in introducing you, you're the architect of this rollout. You want to talk a little bit about what we have planned?
So first, Deb, you're always gracious with your comments about me, but it's a large team that does this.
Oh, of course.
One person.
Of course.
So the planning for this is such. We've applied for all our primary care offices at the Englewood Health Physician Network to be distribution points. So that's 31 sites across our network. It's primary care. And a handful of other offices that would be crucial to do this. Now, for those places, they're obviously not able to do large numbers of people. If you use the analogy with flu vaccine, well, we start roughly at Labor Day, and honestly, I still gave out a flu shot the other day. So, it stretches on for 3 or 4 months. It's often attached to your office visit. A lot of folks see their doctor a couple times a year, maybe 2 or 3 times a year. Oh, you're coming in October, well, just get your flu shot in October when you come. Yes, we do some flu events. We've had some drive-throughs this fall. Various municipalities do flu events. But my point is, there's not this urgency to get the vaccine. So whereas we will have it in offices, and if you're 75 and the group has been called and you happen to have an office visit coming up in a week or 2, then your primary care office in the Englewood Health Physician Network should be able to get that for you. Some of the offices are also preparing little mini clinics. Maybe on a Friday afternoon or a Saturday morning, they could get 50 or 100 or 150 people through. What we're also working on and making a significant commitment to are 2 large-scale vaccination sites in the Englewood vicinity. And between the 2 of them, we ought to be able to do about 1,500 people a day. And because they'll be just dedicated to that.
1,500 people a day.
Yeah, so obviously this requires a lot of logistics. It requires, computer backup. It requires the space, because we can't do it on campus. We can't bring 1,500 people a day and that number of cars to campus. It would be chaos. So, we have secured 2 places, I believe. We hope to get them up and running and ready to go in about 2 weeks. I'm hoping for the last week in January. But all of this is contingent on the state giving us vaccine.
Right.
When we talk about these groups, Deb, I think it's important to know that the state is extremely strict on who we give the vaccine to.
What does that mean?
Well,
what does that mean?
And this is where I feel a little bit awkward, because I'd love to have a little discretion. But if, for instance, a 76-year-old gentleman gets the email from Englewood that you're eligible for your vaccine, here's the link to make your appointment online, and he makes that appointment, and he talks to his 74-year-old wife and says, honey, why don't you just come with me? Maybe you can get your vaccine too. Well, we're going to have to say no, because every person that we give a vaccine to needs to be reported to the state that day. Mm-hmm. At the end of the day, every vaccine that we give out needs to be reported. Mm-hmm. So I can't tell you how many phone calls I've gotten about, I'm 71 and I've got asthma, I'm 65 and I have diabetes. Don't I go to the head of the line? I wish that were the case, but Governor Murphy himself has made it abundantly clear that if you don't follow the guidelines, we're not going to give you the vaccine. So we need to play by the rules, Deb. We can't. There's no wiggle room.
No wiggle room.
Yeah, and I feel badly for like that couple, that theoretical couple that I described, because they probably haven't seen their grandchildren in almost a year, and they don't want to go until they get a vaccine. And I get it, boy. That's some of the hardest part of this pandemic is not seeing our loved ones, and I am completely understanding, and I fall in the same category. There's family members that I've not seen in a very long time. But we really don't have any discretion.
So age is really the criteria in 1B and moving forward.
Age is driving this. As like I say, 1C gives us some discretion, but even that's really in the 18 to 64-year-old group. So there we can do some of that, and honestly, I don't know how that's going to play out, because I don't know how I decide who's more deserving, a 64-year-old asthmatic or a 55-year-old cancer patient. I don't know how we're going to do that.
Yeah.
I'm sure we'll work it out. But for the 1B folks, many of whom are on the line today, I'm hopeful that by the end of the month, there's going to be an opportunity to be vaccinated.
Boy, that's good news.
It's great news. So, I was asked this question this morning, so I'll anticipate it. So, we are planning on going to Florida at the end of February. Yeah. Well, I said, it depends on which vaccine you get. If you get a Pfizer the last week in January, that second dose is 21 days later. And when you come to our sites, you will get the second appointment. You'll make the first appointment online. We will give you the second dose appointment while you're there. You'll leave with that appointment. We report that vaccine to the state, and they automatically send us your second dose a couple of days before your appointment for your second dose.
So if
I'm sorry for interrupting.
Go ahead.
Moderna is 28 days. So if anybody's planning travel and they need to figure out, they need to be here for the second dose, is what I'm saying.
Okay. Everybody's vaccinated. Let's say 50% of Bergen County is vaccinated. Are we all going back to weddings and parties and normal life?
I don't think you do. Yeah, I would love to. I don't think 50% is going to do it.
Okay. What does it?
Well, Dr. Fauci kept saying 75% for a long time. And if you've been listening to him very carefully, 75 became 80, 80 became 85. He's sort of nudging the bar up as he talks. The closer we get to 100%, is the quicker we resume our normal lives, and we go out to dinner and we see our friends, and we go and Broadway reopens and the Yankees play. We can watch them play live and all those things. We'll see what people do. I'm concerned that some people are going to hold back and say, I'll wait and see. I think I don't agree with that. I think if you look at, risk versus benefit, there's very little risk with this vaccine. The benefit is enormous. And oh, by the way, how many people died yesterday in this country? We've almost become numb to that. But we all need to do this. So Deb, I'm mindful that we have a few questions coming in, and
yeah. Does anybody have any questions before we wrap up? Let's see. Okay. Here, Dr. Bronquill, I have to put my glasses on, sorry. Do you think, do we have to get a second dose from the same place?
Well, your second dose will be delivered to the first dose place. I mean, that's how they're working this. So when we did the Pfizer vaccine with our team, we were given 975 official doses. Our pharmacists were able to get about 10% more than that out of the vials. and we reported those people, and exactly that number of doses were sent to us this week for the second dose. So I'm not sure how you would arrange a second dose in a different location. It's a great question, but we're planning on you being in the same location for both doses.
Okay. If I'm not an Englewood Health Network patient, how do I get a vaccination from Englewood Health?
So these are also the state rules. The state rules are when we start vaccinating Group 1B, we become open to the public. So we will be able to communicate with our patients via email and invite them, but technically we will be open because that's what the state requires.
Okay. And this question is, does age 75 mean 1146? So what's the cutoff?
It means, are you 75 on the day you get
on the day that you apply for the vaccine?
Right.
Okay. Okay. I don't see anything else coming in, so I'm going to say thank you, Dr. Brunquell, and
you're more than welcome, Deb. I just, for those I'm going to presume that everybody on this call gets at least a portion of their care at Englewood, and so is somehow in our system. Make sure that your email is on file with us, because that's how this is going to get pushed out. There's really no other way for us to do this, frankly. So I've been just sort of kind of politely nudging people to make certain that we have their email address.
Okay. Well, for all of you who are on the call, certainly if the foundation can help you do that, we'd be happy to do that, to make sure you have email in the system. Be happy to do that.
So there's a couple of other questions that just came in that we're
Oh,
addressed.
sorry, my eyes aren't with here.
When you get the email, there will be a link to how to make the reservation. So when you get that notification, there will be a link attached to it for you to make your appointment.
Okay, here we go. Do people that have the virus get the vaccine? Are you considered protected?
Yeah, that's a very common question and a great one. So first of all, even the team members here, the doctors and nurses who got sick early on before we knew what was happening, even a number of those people have lost their antibodies, meaning that the antibodies waned over the 9 months or so since this started. And so we don't think that will be sufficient to protect people. So the quick answer is yes, even if you've had the virus, you ought to get the vaccine. If you just had the virus, like 3 weeks ago, you probably don't need the vaccine until later in the spring. You're probably protected. If there's any question, have your antibodies tested. It's easy enough to do. It's a simple blood test.
Okay.
Any doctor's office can do it.
So we get the vaccine. Are we safe without masks with family members who have also been vaccinated?
If everyone has been vaccinated, the answer is you're probably safe. I will also anticipate that, when are we going to get rid of the uncomfortable masks that we all hate? It's when we're at a point where the prevalence goes way, way down. We're not certain about this, but there's a suspicion that even if you've had the vaccine, that you could potentially carry the virus and spread it to someone else, even if you're not becoming sick. So the masks are not going away anytime soon.
So Englewood Health, we have a couple, both over 75. Will they be able to get the vaccine together?
Sure, as long as they're both 75.
Okay. I'm a New York resident and my doctor is with Englewood Health. Can I get my vaccine at Englewood Health in New Jersey?
Yeah, sure you can.
Okay. All right. So I think that we've covered all of these questions.
Yes. I did see a question about a vaccine in cardiologists and other specialists.
Okay.
Those offices are generally not terribly well equipped to give vaccines.
Okay.
And so there is there's a certain workflow to drawing up the doses, to storing the vaccine, to reporting it. And so we've confined this to primary care offices at Englewood, as well as our oncologists, some of the GYN groups, which often function as primary care doctors as well. If there's any questions, just check with your physician. At this moment, nobody's got vaccine. And at this moment, 1B, we're not ready for 1B. As I say, I'm hopeful that towards the end of the month.
We're looking at about 3 million people in the 1B category in the state of New Jersey, correct?
So just in Englewood Health alone, we have 47,000 people over the age of 75.
Yeah.
And even if I do 1,500 a day, which seems like a lot of people,
it does.
It's going to take us a long time to get through this. So the other thing I'll say is, if it's available somewhere else, get it somewhere else. I mean, it doesn't really matter where you get it. It's all the same vaccine. So some pharmacies have it. I know the ShopRite pharmacies have already started with the 1As. Some of the CVSs have as well. You'll see other sites popping up. The county is doing something. The state wants to do something at the Meadowlands. If it's available, get it.
Okay. Okay. So thank you all. First of all, thank you, Dr. Brunquell, for leading our efforts, and for and on behalf of everyone on the call, for the rest of the Englewood Health clinical and leadership team, thank you. We really appreciate all your efforts. Please stay safe, everyone, and healthy, and know that, again, we're always here for you. Have a good day. Bye.